Hello, we will discuss the etiological factors that contribute to malocclusion, whether they are general, which means that they are inherited, or congenital or environmental, or they are local, which means that we observe them in the intraocular space. Understanding the etiological factor is essential in order to prevent, intercept, and correct the malocclusion. Malocclusion can happen at any stage of development. It can be prenatal or postnatal. If any trauma happens to the child while he's being delivered, some pressure may happen on the temporomandibular joint and may cause an injury for it, or cerebral palsy may happen, or any other injury during the birth. After birth, traumas may cause during the development. Maternal diet may affect some diseases like the German measles, and some metabolic diseases like the hypothyroidism or the hyperthyroidism that we will discuss, these and many causes. The hereditary factors affect the jaw size and the size of the tooth, and this harmony is greater in population where there is a mixture of racial and ethnic strain. So some macrodontia or microdontia abnormalities like the peg-shaped laterals are heredited in origin. Also, the number of teeth, heredity has a role in it. The dimension of the arch, and we have said before that crowding and space may be caused by heredity when a child gets one of his parents' jaw length, and from the other parent the tooth size. If there was disharmony, we will see that crowding or spacing may develop. Also, the timetable of eruption of the permanent and the deciduous teeth heredity has an influence on it, and we can see that there is a specific pattern in each family of tooth eruption. We know that the skeletal configuration also has a role in it, which is genetic. One of the most common congenital deformities is the cleft lip and palate, and it influenced the craniofacial development and caused malocclusion of varying degrees of severity. It may retard the development of the maxilla and causing class 3 malocclusion because there will be and the maxilla will be less in space, in wideness. The cleft lip and palate may have an effect on the tooth. We can see some of these effects like extra teeth, the big-shaped teeth. We can see that there will be crowding in the area where there is the cleft, or we will see that there will be no teeth. Crossbite rotation may also happen, and the lack of premaxilla formation. These are the signs of the cleft lip. Some of other diseases that affect the orofacial area is the clavicle absence. We can see that maxillary retusion and mandibular protrusion may develop, retained deciduous teeth, and retard eruption of the permanent tooth. Also, when the mother get affected with the maternal rubella, or what is called the German infection, rubella, the child may develop a retarded eruption of the teeth, or hypoplasia of the teeth, and extensive caries. Some of the endocrine factors that may have an influence is the hypothyroidism, which means that there will be a lack in the hormones that activate the metabolic action. So we can say that there will be a retardation in the rate of calcium deposition, delaying of the tooth bud formation, prolonged retention of primary and delayed eruption of the permanent teeth, and a tooth arrangement irregularities like crowning. As for the opposite, the hypothyroidism, which will be an increased metabolic rate and increase of maturation, patient will exhibit premature eruption of primary and permanent dentition. Now let's go closer to the oral space and see what we can see inside the jaw. We can see anomalies in the number of the teeth. We may see extra teeth, or that is may observed in the lateral incisors and the premolars. Mesodense is a word that is used to describe an extra tooth in the midline between the two permanent maxillary central incisors. The peg-shaped laterals will cause spacing in the arch. Also, another terms that we must hear about is the anodontia is quite rare, is the lack of the ectodermal dysplasia, which means that no tooth will be developed and it is considered rare. Partial anodontia will be the presence of one or more teeth. The hypodontia is the absence of only few teeth. Oligodontia is absence of more of the teeth. Also, we can observe what is called the talus cusp, which is an anomaly that on the palatal surface of the incisors. It may prevent normal overbite and overjet, and this force of the adjacent of the opposing tooth may cause a tilt in it and make a tipping movement. This anomalous structure can be found also on the premolars, and it is called Lyoung's. It can make an obstacle when the patient occludes. One of the other things that we may see is the gemination of two teeth. Gemination is there is a difference between gemination and fusion. Between fusion and gemination, fusion when we have normally separated two germs that being fused together, but gemination when we have a single tooth germ that is divided and became incomplete formation, then it will be fused once again. So we find it like in this an abnormal eruption of a tooth, which we see it clinically that we feel that it is two teeth that been fused together, but it is like the germ has been divided into two and then fused together non-normally. Early loss of deciduous tooth, for example, the second primary molar, if it was lost, the first permanent molar will migrate in the mesial aspect, and the premolars will not have enough space for the eruption, and the crowding will develop. One of the most common tooth that may exhibit abnormal eruptive pathway is the canine, because it travels a long distance, and it is the last in sequence of eruption in the arch. Also, it is affected by any abnormal eruptive path of other tooth adjacent to it. One of the common things that we may see is the ankylosed mandibular deciduous teeth, whether it is mandibular or maxillary, and it will make a retention of the deciduous teeth itself and prevent the delay the eruption of the permanent tooth underneath it. I think that we got a brief overview of the etiology, the factors that affect malocclusion, and we forget to say about the environmental factors that are the habits, the oral habits that we will be discussed in a separate chapter, and how we can intercept and prevent it.